Is blepharoplasty the best option for me? Hello, I am 59 and have had dark circles and bags for years. I am finally looking to do something to make my eyes look better. Is blepharoplasty the best option, or are there alternatives that can help?
Thank you for your question. You submitted a photo and you stated in your question that you're 59 years old and you've been dealing with under eye bags and dark circles for quite some time. And you're asking, is blepharoplasty the best option for you, or are there alternatives? Well, certainly, based on just the photos alone, I can give you my opinion about how I approach patients like yourself in my own practice. A little bit of background: I'm a board-certified cosmetic surgeon, fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and certainly this is a problem that we deal with every day. And as an oculofacial plastic and reconstructive surgeon, I can also give you some guidance as to the importance of the right approach to your issue in terms of your eye health, which is very, very important. So to begin with, let's start with first diagnosing, or at least giving you my impression of what I see when you describe the under eye bags. The reason for those under eye bags is something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat pockets that are normally around the eyes pushes forward, herniates, creates these bulges. MRI studies have actually shown that in a lot of people, these fat pockets actually increase in size, in volume, resulting in these bulges. So it's not just that it pushes forward and because of a weakness in the tissue, which is often associated with aging, but also there's often increased volume. Now, in addition, as people get older, there is also important elements that have to be addressed when you are considering something to do for this problem. And that includes the integrity of the support structure of the lower eyelid. One of the things about cosmetic eyelid surgery is that it is sometimes oversimplified by a lot of my colleagues, and unfortunately, when they perform this type of surgery, patients will have problems such as lower eyelid retraction, where the eyelid is pulled down, or ectropion, where the eyelid is everted out. And it has to do a lot with the integrity of the support structures. And this is where, being an oculoplastic surgeon, I look for these things and I actually make it a point to address them at the time of surgery to prevent these type of problems. So, in terms of my general approach to a situation like yours, well, to begin with, when I evaluate a person who has similar issues, I make sure that I look at their dry eye history, whether or not they're on artificial tears, whether they have any issues with that. That also is a factor in how the surgery is performed. I look at the integrity of the muscle that supports the eyelid, the integrity of the tendon that supports the eyelid, and then I discuss basically the two different approaches to addressing the fat pockets. When we talk about blepharoplasty of the lower eyelids, there's two approaches. One is called a transcutaneous approach, which is more commonly performed by I would say the majority of general plastic surgeons, and that's where the incision is made on the outside, and a transconjunctival approach, which is done from the inside. Now, in my experience and my personal style, I generally prefer to do, even on people who are a little bit older, something called a transconjunctival blepharoplasty, where I address the fat pockets, but I maintain the integrity of the skin and muscle and support structures. If the tendons need to be reinforced, there are other procedures that are done in addition to that, but I like to keep that front part of the eyelid stable, because that's the muscle under the eyelid called the orbicularis oculi muscle is like a hammock, and it holds things in place. And a lot of times well-meaning colleagues will actually make an incision on the outside separate these layers and then trim off some skin, and it ends up causing the eyelid to evert. Or in doing the procedure this way, there's a loss of the structural integrity of the lower eyelid, and that results in requiring additional surgery. When people ask me, but what about all these wrinkles under the eyes? I try to explain that there's a difference between relative quantity of skin and relative quality of the skin. And typically, I have found that we can address, there is very rarely a time when there is a true excess of skin. And usually it's more about the quality of skin. So how do we address quality? We address it with use of platelet-rich plasma, which is derived from your own blood, to stimulate your body's collagen and basically deal with the loss and thinning of the skin with age, as well as the use of lasers such as fractional CO2, fractional erbium, or ablative of either type of lasers, but basically to improve the skin quality and improve the wrinkling. The goal is not to create porcelain smoothness, but to improve the appearance and improve the discolorations and the dark circles. Our overwhelming majority of the time, people have an improvement, and if they want to further enhance the eye and cheek area, this is where we talk about fillers and ongoing treatments, whether it's PRP or other things. But a lot of times, once people have their bags done, they're very happy not to have bags anymore, and so they may come in for other things. Botox and other complementary procedures always has a role in maximizing the aesthetics of this area. But certainly, from my perspective, the critical decision is the type of surgery being performed and the way to preserve the integrity of the eye and the eye health. So meet with qualified, experienced cosmetic surgeons and understand these issues and before moving forward, and go with who you feel comfortable with. But I think you'll find that this can be a very, very nice and gratifying procedure, because once you getting rid of bags under the eyes, I feel, is almost like doing a facelift. It really just brightens up the entire face. So I hope that was helpful. I wish you the best of luck, and thank you for your question.